My name's John Frenzel. I'm an anesthesiologist at MD Anderson Cancer Center. I'm also the Chief Medical Informatics Officer there. Been there for about 15 years. The first priority is putting this patient at the center of care. A lot of times medicine isn't necessarily practiced with the patient at the center of the work. It's structured around other more artificial constructs. And there's lots of pressures coming to bear on practitioners. There's pressures to bear around productivity and quality metrics and documentation requirements, things that in some senses were completely different than those that were there 15 or 20 years ago. When we looked at implementing our new AHR, we looked at those ancillary technologies that were out there that had changed while we had been working on our previous EHR. And when we looked around, we found that voice to text was something that was extremely viable and had a very compelling return on investment. From a temporal standpoint, be able to turn around documents much quicker, be able to bring the documentation and the information necessary to make decisions much faster to the hands of clinicians and to the hands of our patients. Our electronic medical record, for the most part, is completely open. Our patients are able to see everything nearly in real time. So the faster those come back to the record, the faster our patients are able to see that, understand that, ask questions, and become a partner in the care process with us. And so we saw that Nuance technology was able to speed that flow of information, not only between the providers, but also between the providers and the patients. So when you begin to implement new technology in any sort of healthcare environment, you have to understand the impact that's going to have on your providers. And one of the ways you mitigate that impact is obviously by the way you build and deploy the electronic health record. Integral to that deployment is training. Nuance EHR implementation services helped us with rolling out the whole Dragon 101 and Dragon 201 classes. They're instrumental in putting together the curriculum, doing at the elbow support, helping our providers actually understand the technology and work through the voice profiles. When we started down the road to install a new EHR, we looked at what leading organizations were doing in terms of their EHR technology. And one of the goals of bringing Nuance and other leading edge technologies into our technology stack was to accelerate our ability to get to a very high level of functioning from an EHR standpoint. We moved out of a transactional environment that waited days to get results, to minutes to hours to get results. It was a substantial change to our organization, but an incredible change for our patients, a huge change for our providers, and one that there's no call to go back on. It was the right choice. We believe that we have a vision of healthcare that's compelling, and we want to be able to influence the roadmap of our partners so that we can improve healthcare not just for our patients, but patients across the planet. We want to take and use our partners as resources to help the battle against cancer and help stamp out this disease.